Hey, welcome you all. So we are going to learn vaccination in special situations in this video. So just to go back and have a recap, we have certain additional vaccines as per Indian Academy of Pediatrics, that is the national body of pediatrics in India. So this is a recap of the vaccination schedule as directed by Indian Academy of Pediatrics. That is the latest immunization schedule in published in 2020 to 2021. This is the recommendation given by Indian Academy of Pediatrics. I hope you all are very much aware of the national immunization schedule as of now. So it holds the good, almost it's very similar to national immunization schedule. In addition to the vaccines available in national immunization schedule, here we also have certain additional vaccines. So we go as by birth we are giving BCG, OPV, Hep B, and 6, 10, 14 weeks we are giving pentavalent vaccine and injectable polio vaccine, rota vaccine and PCV, that is pneumococcal conjugated vaccine. The change in IAP vaccine compared to the IAP recommendation compared to the national immunization schedule is the IPV, that is injectable polio vaccine, and the pneumococcal conjugated vaccines are given as 1, 2, 3 at 6, 10, 14 weeks instead of 6 and 14 weeks in national immunization schedule. The influenza vaccines, which are optional vaccines, have been introduced can be given after 6 months. The typhoid conjugate vaccine, again not available in the national immunization schedule, can be administered in the later half of the infancy. MMR instead of MR is administered at 9 months and followed by 15 months. Hepatitis A will be introduced at 12 months and one more dose after 6 to 18 months. So these are the few changes what you can see in Indian Academy Pediatric schedule. So we straight away move on to the catch-up immunization in adolescents. The children who have missed their vaccines in the infancy and early childhood can be still vaccinated when they come to us and when we know that they are not vaccinated. So any child during the adolescent age, if they come to us without the previous vaccination data, so we would like to compulsorily vaccinate certain vaccinations that include MMR. So every child should receive at least 2 doses of MMR at 4 to 8 weeks interval. If the child has received already 1 dose, so he can be given 1 additional dose. Hepatitis B and A. Hepatitis B should be followed at a dosage schedule of 0 and 1 and 6 months, 3 doses. Hepatitis A can be given at 0 and 6 months, that is 2 doses. To give hepatitis A, we can have prior check of anti-HIV IgG antibodies. Typhoid TCV, that is typhoid conjugated vaccine, can be administered as single dose. Varicella has to be given as 2 doses at 4 to 8 weeks of interval. So in certain special circumstances, the vaccinations which are recommended for the children are influenza vaccine, which can be given every year, 1 dose. Japanese encephalitis vaccine in endemic areas, and catch-up vaccinations can be continued up to 15 years of age. Pneumococcal polysaccharide vaccine, that is PPSV 1023, 2 doses can be administered 5 years apart. And rabies vaccine, as all of us know, we need to give it as pre-exposure and post-exposure prophylaxis, and the schedule changes. Post-exposure we need to administer at 0, 3, 7 and 14 days soon after the exposure. This also when we go to the rabies vaccine per se, we will know how to administer the rabies vaccine. And in a case of rabies bite of category 3 and 2, we may also have to give immunoglobulins as scheduled. So we will be discussing it in the optional vaccines video. So coming to the immunization schedule for the adolescents as such, though they have, even then when they have received the previous doses, are these: Tdap, that is tetanus, Diphtheria for the adult and acellular pertussis between 7 to 10 years, 1 dose if indicated, that if they have not received at 5 years. 11 to 12 years, 1 dose. 13 to 18 years if indicated. If indicated in the sense if they have not received the 5-year booster or a 10-year booster, or if the child has got severe trauma, exposure, probable exposure to tetanus spores if not previously immunized. Human papilloma virus, based on the brand company, we may have to administer HPV vaccine. So 3 doses, and 13 to 18 years we need to give 3 dose, complete 3 dose series. So as I explained previously, MMR and varicella will require 2 dose series. If already administered before 5 years, so child will require 1 dose. Hepatitis A again will require 2 dose series, 0 and 6 months later. Hepatitis B or 3 dose series, that is 0, 1 and 6 months. Typhoid TCV may be required, can be administered as single dose, but may have to be repeated every 3 years. Influenza vaccine will be requiring to be given every year. Japanese encephalitis, as I have mentioned already, catch-up vaccination may be given up to 15 years. Now, which are these special situations? When are we going to choose these the vaccines in a high-risk group? Who are the high-risk children and what are the high-risk situations? So, the vaccines which are recommended for the high-risk children are: one is meningococcal vaccine to prevent meningitis due to Neisseria meningitidis, Japanese encephalitis vaccines, oral cholera vaccine which is not available as of now with us, rabies vaccine, yellow fever vaccine, and pneumococcal polysaccharide vaccine. We do consider pneumococcal conjugated vaccine if the child is not previously immunized. What are these high-risk conditions? So, high-risk conditions include congenital or acquired immunodeficiency, including HIV infection, immunosuppressive therapy and radiations, chronic cardiac conditions. The child has got congenital heart disease or some acquired heart lesion where there is a regurgitant flow and may be prone to develop endocarditis. These conditions we may have to give pneumococcal vaccine. Chronic pulmonary conditions which include asthma when we need to treat them with prolonged courses of steroids. Chronic systemic diseases including renal, including nephrotic and nephrotic syndrome. Hematological conditions where the children come to us regularly for blood transfusions, for example, thalassemia major. Hepatic diseases, diabetes mellitus, where we need to prevent the opportunistic infections. Functional or anatomical asplenia or hyposplenia, including sickle cell anemia, where there can be autosplenectomy. CSF leaks, any prosthesis when we put cochlear implants for pneumococcal infections. Such cases also will be classified as high-risk conditions and may require vaccinations against deadly infections like pneumococcal, meningococcal and influenza vaccines. So, which are the children who can be considered as high-risk groups? Children who have pets at home, so rabies vaccine may be indicated in such cases. JE in endemic areas, Japanese encephalitis vaccine. So, in and around Karnataka, we do have Japanese encephalitis near forest areas. So, these children may require encephalitis JE vaccines. So, during outbreaks, cholera vaccines, and for travelers, again yellow fever and meningococcal rabies vaccines may be indicated. So, coming to a group of immunocompromised children, immunocompromised can be congenital or acquired. Congenital include primary immunodeficiency disorders, and acquired may be something like HIV. So, in children with HIV, the immunization schedule slightly varies. That includes most of the cases when we start with immunizing these children to live vaccines, we may have to take some precautions because these live vaccines themselves can cause disease in the child. So, when we administer live vaccines, we make sure the CD4 count in HIV affected children are at least 15% and above. If they have the CD4 count lesser than that, then live vaccines may be contraindicated. The inactivated vaccines or killed vaccines can be safely administered. So, in a child who is asymptomatic, all the vaccines can be given. If the child is symptomatic, the live vaccines, especially the BCG, oral polio vaccine, measles, MMR, like vaccines are contraindicated. So, continuing with the same, varicella vaccine, when varicella, it's a live vaccine, so when the CD4 count is more than 15 years, we can safely administer, otherwise we need to, this vaccine is contraindicated. So these are few certain conditions, these are few situations where we need to take care of the vaccinations, and most commonly is the high risk group, where we need to address these children and administer all the optional vaccines which are not exactly available in National Immunization Schedule. Thank you.